we are at multi-sectoral level. Yesterday we had different sections. So we decided to do a presentation on shooting. So SBC, talking about social parenting from different parenting communication. We had different sections for signals. Thank you, sir. We have different sections to find some specific norms. Today, the rapporteur is ready. A wrap of what we did yesterday. After which we will take it on from there. You have just minutes. So please put your hands together for you.
To 1:17 to 2 p.m. And then for agenda 5, speeches and experiences, the provost spoke about their good work, UNICEF good work, and his experience study, where he and some people visited some states in Nigeria, saw the report, and then gave a report about their experience. Mr. Hoshim also gave a speech on skill sharing intervention. Okay, Mr. Ibrahim gave a speech on skill sharing on successful intervention. X can be used to tackle those norms as well. Professor Ayodele also spoke about polio, convincing a man to take his children for vaccination. The SBC specialist spoke about a meeting with cleric heads to also help. Another experience mentioned was a woman who was being called lazy if she goes far to give birth. And so a report was given about the village, and now they have a hospital in the village at a place called Kagogo. The SBC specialist spoke again about another experience of a woman who lost her daughter to female mutilation, and concluded by saying an area where they got a lot of support from UNICEF, particularly with nutrition, where women were also spoken to go to the hospital during pregnancy and childbirth. And then another experience where they had to give an example with family system just to help women to understand the importance of family planning. At the end of the meeting, the SBC specialist spoke about the fact that today we are going to be here to analyze and talk about the solutions that can help in changing these norms and helping the normal Nigerian child. Thank you.
Thank you very much, rapporteur. You done a huge job, and I think we can improve our plans. So the same thing you done yesterday, please repeat it today. So please put your hands together for the team again. Thank you very much. Before we do anything today, our sponsor, talking about this, will be giving us a small presentation because this is like that. Don't forget what I said, it's going to be very, very compact. Very, very compact because we have 4 hours. So put your hands together small for Mr. Ibrahim. Thank you very much.
Colleagues, thank you for the recap. I think just like Prof said, I think the recap will be open to everybody to make inputs. That was quite great, so that we have everything comprehensive. If you feel what you have said is not captured, please help us to pitch it in. Thank you very much. Now, it's just to run us through what we have said, probably verbally yesterday, and again, we are going to share the slides with everybody just for future reference. Shift to SBC. We're still trying to really get that clarity as we're leaving this place today. Now, the results are central to SDG and to UNICEF work and mandate. You will see that The objective we gave yesterday, they are all in line across the sector. For each sector, there is there is SBC in each sector, and across the sector, there are the lists that need to be uh, implemented. Next. Okay. Programs do not always draw from XPC and behavioral science to define which combination of intervention can effectively remove the barriers to change. Too often, we rely on messaging. We mentioned this yesterday. Instead of investigating and tackling cognitive and social and structural drivers. So again, let's not rely on just messaging for how we're going to be investigating and tackling social and structural drivers. And what are those drivers? Part of it is what we mentioned, and we are really focusing on how we're going to get solution today. Next slide. Okay. Communication remains critical and central to what we do, but we need more. On top of being great at individual and community engagement, we need to pay more attention to policy, services, product delivery as key SBC programmatic. I think what we're going to be doing today in terms of how we will generate intervention or solution for all the social norms we have seen, behavioral assessment, social listening, human-centered design, choice architecture, social accountability mechanism, and participation in local governance, strengthening sectorial system through SBC plan. So these are some of the interventions that can probably bring change into it. But let's go. Want to use next slide, two of these strategies just to reflect what we have said yesterday. What does it mean to expand? Yes, expanding, shifting from C4D to SBC. In 2022, it was announced at the global level that that shift from C4D to FCC came up. And the approaches C4D will, like I mentioned yesterday, C4D approaches will still be used, but we have added approaches that go beyond communication. Who doesn't want more tools? I think this one is just a trigger. Now, if you look at the second statement, C4D approaches will still be used, but we have added approaches that go beyond communication. I will reflect that approaches will be reflected. Next slide. Now, so this is where we are. Before now, risk communication and community engagement. This is one component that is still domiciled in terms of disease outbreak response. And even up to now in Nigeria, we're still using this angle, especially in State Ministry of Health across Nigeria. And even at the national level, this is quite in use at all levels. C4D again at some by Thank you. Yeah. I didn't go with trend, and I will have to. I didn't go with trend, and I will have to. I have to go with the guy. Anyone, you know me. Me, I be Iskafa. Anyone that will work out, just go with. No, wallahi, I just walk out, drink water, leave house. This guy, he put all in the flags for use it. Um, but but it's okay. Yeah, so you need to open this morning. Okay, 12. If 12 is okay, open can be okay. Mhm. Mo ma ẹ jẹ́ n sáré mo ti wọ́ okay mo máa send ẹ̀ sí mo máa send. Oh, I've not written history. Yeah, I've not. I didn't even write yesterday. Thank you, sir. Mm. Yes. Which one? And I applying. I'm a then campaign. I want to I eh? And I approve. And so we expect next week, not this week. But January is submitting. To work, we have done our own here. The remaining one is in Abuja now. Yes, yes, that's okay. And just do it for him. Any LJ that he cover, then they can start. But give me the training plan so that I will share with National. Assalamu alaikum. Sami.
So you want to spend the time with you.
Thank you.
Said that he's telling us, I'm just knowing that I can finish it within 1 minute. If I walk down to ES now, that's it. If I walk down, but your wait, I can't hear you.
This thing that we are doing now,
You are
this thing is
helping me
providing.
now.
It's
You are
what
helping me.
it's what
As someone have is facilitators in one state. It's even an advantage. You people are helping me.
you don't appreciate that.
He doesn't want, but wait, I've told a lot of guys, Issa doesn't want being so. Look, my batch is at 4 million. Wait, my batch is 4 million. That guy I'm iron. 4 million. Take one on January. I paid for 4 hours. He did not give anybody that. He didn't take anybody. That's the money I use for you, Yunus Abdulkadir. That's the money I use for Amina for 4 states.
I didn't see reflection here.
You don't want
This is part of the Ibra money I brought to Kaduna. He never wanted it. Nakira Alhaji Hamza, even last month. Isa is like, he's no willing. Nakira Hemu.
the problem is we are coping with this problem.
He doesn't want
affecting us with
anybody.
SIOs.
Let's say if he's called member, I will come as for you. I will be paying. Nothing. That guy money Idris. That guy money Suleiman. He said I should get Alhaji Hamza to pay. That guy Orange. They say the only person I'm only slowing down for, I tend to call me, is Alhaji Hamza. I can't some percent tolerate nonsense. But I feel you will be able to tell him before I even tell him. If not, Wallahi, Shiba would be he's a daunting. There's no health educator that say, you are helping. If you see Usman has finished, I have Nasra as science.
They all
But
sent
then
to me
Nasra,
yesterday, but 3 of them. Just start to review. We have finished it. Just review. They not review. Now I have to send it to you like that without him reviewing. By the time we start talking, we say we do it our own. He doesn't even know what we've done. Just review. We've done it for you. Just review.
I can go as far as commissioner. I can go any me. The kind stubbornness in me is not here. It's more than 100%. And until I break that chain.
Sometimes I think whether we don't want this job.
No. Me the I am we gonna do. Let your I am. Don't if you see me trying to be very rigid here in place. I've worked in all there is no part of Nigeria, northern Nigeria that have not worked. The only state that have not sit down and work is Adamawa. In 19 other states, there is no state that have not worked as far as it is going on. And if I jump all of them and go to ES now, director say, but again, I can fix it. But I've told him several times.
You know? And in fact, he's trying. He's the only person that is.
No, I didn't see them as somebody that can talk. If you see them, what I am there's nothing I am can do. Brian is his best friend. Director, you see him as if he can't do anything. No, sir. I see that. But what's happening? I will need to go so that I will come confident. Is it within the postgraduate school here?
Okay.
Mm.
So,
Oh, no problem.
okay, so 30. I don't think. No problem. Okay.
Ah, you know, yeah, Angel, no one can stay and wait. Is it network?
See, I'm missing the two. See, my wife is there.
Nah. What did you beat in Colombia?
Where's the next one?
Okay. Oh, very good. How about you? Yelawa is in fact is what you also use finally. My other.
It was actually
Okay. Yeah. Prof. This one person, but he came.
was he around this
He was not around. So just
That's why we don't know.
I came in for Kano.
Which session does it belong? Like, where am I doing a session now? Where does it belong?
He's supposed to be in
It's not
CS.
there.
He's not there. He's not.
Somebody invited.
Talk. You just sit there. Don't worry.
Okay, because he was.
Sit there. Sit there.
What you not saying? What you can say to this, I'm happy.
Okay.
Email fire that you not.
Even if you don't get, don't worry. I'll get card to bring you.
Sorry, I shall like to work.
Okay. They are the people that I sent for CSO, but that one will show up. Well, actually,
Made serious impact.
and he's very active, very active.
Just look for where the CSO is now.
Hmm?
It's better than one CSO.
Let me join on. He's very active. most of the programs guys, can you I need this to know because this is what I want you to use. Oh, ah, eh, only. So ethnic project, is example that I just did for them. And well, if they are unable to populate it, it will now be left to facilitator to collect it. Everybody are now input it here, no problem. But at least let's, including the facilitator and everybody, let them have the concept. White far. Okay. Yo. It's Excel. I know what to do.
The one is one thing. Still, the other has to be moving.
No problem. That will be the best. So that one day will come back. This is okay. Hello, colleagues. Thank you very much for the group work. We are sure that social pressure, misconception about religious uh, necessity, coupled with limited enforcement and law awareness, FGM still exists. But again, now this is where we are. This is where you've been like working on since morning. Strategies, approach, and plan activities that you feel you should do to change the narrative. Now, for instance, these are all examples that I'm just trying to give so that we're able to like fuse our ideas together. Community engagement and dialogue. Organize community dialogue and advocacy with traditional religious leaders to promote abandonment of FGM. So we feel like this activity, if we probably tailor it very well in terms of strategic focus, will gain mileage. Again, mass media and social media campaigns, putting social influencers' role and mass media together, develop cultural sensitive radio programs, social media content, and storytelling campaigns highlighting high risk and legal implication of FGM. Again, we have social media influencers, we have media here. So we're also seeing that if you could come out with this, it will also be changing the perspective, the behavior that practice FGM. Now, school-based interventions. We're also looking at integrate anti-FGM message into school health clubs and the rest like that. Who are to help us do that? Yes, we have the medias. We have the media group here. We have social influencers. We have ways that we can also link up with schools. Of course, we even have private sectors here. So cutting across uh, private public sector relationship, I think we can also fuse this intervention. But again, how can we do this different? We will need capacity building to really know what to tell them and how to go about it. So this is where we have since morning in terms of strategic development or highlighting the plan or activities or strategies that we feel can take care of what we're identifying yesterday as. So we're going to put the bit by bit of everything we have put down into this. Then Prof will now see how we're going to implement this activity in line with what we'll gather here today. Because everything we gather in terms of issues, challenges, all the FGM, so that we're going to populate it here as problem statements, challenges, and issues. Then the strategies we're now co-creating today, we're going to populate it here. And of course, for instance, person responsible here, mass media and social campaigns, you will see that this is where the media team will come in. Yes, we will put it as media team, but again, somebody need to also follow up and ensure that that is ensured. Prof, I don't know whether you have, and I want our, our facilitators to also add their voice to it so that we're all on the same page. Thank you.
Thank you very much, sir. Now, I'm sure you've done something almost similar. I tried to read your mind. The only difference from what Guy Bryan just did from what you did is that this strategic plan and objective, target, attract indicators. What you've done so far, if I'm right, is this other portion here. Yes, this last two columns. Am I right? Okay. So our various facilitators will also enhance the other portion here. I will share this template with you. Just be very specific about this last two, 1 and 2. Very important. So I will leave this here. And you look at what you're doing, what you've done, vis-a-vis what you see, so that you will be properly guided. Because it's on the basis of this we'll set out for the main work. This is not the main work we are doing. We have a bigger task ahead of us. So please look at this portion and then align what you've done following this pattern. Is there anybody with any question? Because we have one other major activity for today. Yes, question? No question. So if you have done it, you can just quickly bring this. Just work with this first 2 columns, which you already do. You have already done. Give the other ones for the facilitators to build on. So are we good to go? Because after this now you will come and present immediately. Any question? So silence is what? Constant. Thank you. So can I give you a minute to look at what you've done? I will start calling you group by group. And this today I'm not going to call anybody in any particular order. Now, okay, I'll send the template to you now. But I will not call you in I'll call any group to start. So don't think I will start with this first group so that I don't miss. I'm excited to start with. Now, someone you have me. So I will send this template to you quickly to the group.
So and Zoom, and unfortunately, the ES is the quiet type. Babu, I don't have any problem with anything. Doctor, Doctor Usman, Masinawa. No, not Doctor Usman. Usman, yes. If I call him now, if you see the way he gives attention, let me talk about any of his boy not doing the right things. That Angama, he's coming from, he's a family physician of the governor into primary. Tell him anything, they fear him like that because he have that code very well. You see that who are you? The student don't report to commissioner, she report directly to the governor. If I call him and prof, I'm having problem. In fact, Dupe will never try it. Dr. Dupe will never try it to see that he has problem with that he land her in ES never. And why I'm logical? Alhamdulillah. If you are the type that put eyes in people's things that don't concern you, you have problem talking to these people. That's what we just said. So, so if you don't, for me, it makes life easy. You will be very, you will be ashamed. But wallahi, he will tell you one thing, but me, if I go to me, keep quiet, it can just avoid me, but you keep quiet, but you know I can go far beyond that.
So in Niger, Mohammed, Mohammed, when Niger is like my home. Dr. Kene is a boy to my brother. Kobe Gudaba was lies and Giganchi. He's like a boy. If you see my brother coming, he'll be crawling now. And he's the palm sec. Man, is he didn't crash Chewa Gab. Voice like a there was one money that was hanging in Niger. Was like I retiring and Chewa Haya Kidan Basuniba. So was like retiring. We refund. They have funded it this morning because they know I will go beyond it. Wallahi. I mean me, Isa is having his way, and I'm only matching break for one thing. Wallahi, I'm only one. Director is always up and doing, and he has asked me, let me know anytime there is problem. But there is problem. Nache, Kadoku Mutani Jew that we can even register them also. By the time we break his chain a little, the car is not willing. 4 million during Ibra, which is October, November, December, January. Give me one strong person.
When we are doing things, we are sidelining them. What do we do that with sidelining?
Doing things sideline the Kaduna.
Okay, we should see. We should see.
I Solina and Tura for the Zua account national. Boom. Big idea and Zuna wouldn't where let's send the money to the elders. It's a system doesn't operate like that. We really send to government, do the needful.
So I'm saying what
So he will like Victor more than you.
He likes it.
this check.
Do you? Let me see. You know what?
What happened in Niger is that I am Niger calling that this mistake they are doing. How would they send money to one account, 72 million to one person's account?
So
Yes.
they have an angle here.
So, but the good
Civil
news is
society,
that they quickly disbursed
civil society.
to the beneficiary. But now,
Okay.
go to the
Private sector.
before years sign,
Have
before
you
this
seen
sign,
it?
those release.
Media. Media.
And
Have you seen it? Media.
that's what national is avoiding. They are structuring it. And this is the last time for UNICEF. Don't do it that way. Much.
Better.
And then
That's so good now. Is it?
I ain't the children go up. Do you think facilitators will always
You
exist?
should be that myself.
If
I'm saying to your group.
all of us were looking.
So let's be fast about it. This should be fluid.
It is winning why primary no. Get me somebody that is solid. Sit down with you. I am with feelings impact. Na ba su na bincike zan kawo ba. Amma da tun lokaci ba na ba su. Ni ma ya and if you tell SNO babu abin da zai yi.
So wait, he signed it. Mama was just. Hey, influence. If you tell Isaiah will sit down, he will sit down. If Isaiah will tell you to sit down, he will sit down.
How about
Our problem is that he will do his job and he will allow us to do our job.
no, let it frustrate it and let's
Since yesterday, they showed me the 3 states. They sent to me, sorry, just to review.
we we have packaged somebody for CS to go and meet ES, not even me. Top bottom now. So that's fine. And insofar as you guys are the technical team that will support it. Oh, let me continue. I'm able to take hold Nasarawa, Kwara, and then they're very tight. But the way Niger people hold me at the highest esteem, oh God.
I took a book. Now look at how these people are. I took a book.
Yes, sir. But does it really make sense?
Babala's face.
Eh?
Babala's face.
Sorry, and would make a
These two musketeers.
yes. Oh, I'll come to the office now. And let me just round up what I'm doing. I'll come. Mm. So at the end of the day, where to mark pay one, rọra cost ṣe rí i pé lára ọ̀sẹ̀ nínú mi ní kàn fi cost sí ní ẹ̀yìn ṣe rí i pé activity tí mo sọ fún yín ti ń jáde bá. So it depends on how people are able to also bring ẹ̀yìn láti review it to make sense. That's why I had to think of something that will be very clear across the. Mo mọ̀ pé méjèèjì tẹ̀sán is fine. Yesterday, these are the norms that we identified, and today, these are the that is the highest one that I need. Probably, how long will it take you? Okay, I will reach.
Okay. Additional information, please. As you, oh my God. Please add your timeline, okay? Those identified strategies to give a
Oh,
full timeline and who you think should carry out that activity. And in this respect, you look for people center around from various groups. Cover, are you with me? Don't forget, there's a timeline, okay? Is it for 3 months? You pick each of those items, say, based on what's identified, then you pick the timeline. After you give the timeline for each of those items, please suggest someone that can responsibility. For instance, you said engage community and what dialogue, organize community. Okay, from January 4th to January 5th. What you do is identify somebody. So I don't know what you have identified at that point. This is important. So they're going to give you 4 different columns. The notes, the strategy, the timeline, and responsible individual. So if this is the first one, you can now draw a line from this end up to this end. The next one, you draw a line so that you can put them in different columns. Do you get it? Do you get it, please? Do you get it? You know, when Mr. Brady comes, it's always too technical. That's why I said you should come up now. Are we together? You didn't get it because we're just coming. We have identified the norms which we agree today. Now, what strategy to adopt to change that which we doing since we started this morning? Now, for each of those identified strategy, identify timeline. Each have really been 5 different strategies. For each of them, just create the column and tell me the song will take place between January for and then who should do that thing? The expert person. It's as simple as that. Just work with yours. Let's say we're going to have no, that's the 1 week. Should be enough time. Anything.
time frame? No, it depends on how you think.
That's why I want to be the one to be able to your what's it called? Your facilitators to guide the business. It's Mr. Khalid is here, Dr. Omate is there, and the president is there, Dr. Hinari, and what's that? Dr. Adesu to help sorry, to help identify the various timelines. How long should that activity last? Please let's be fast about it. We are going to keep this place 12 o'clock instead of 3. I see that it's 10 a.m. as well. Yes, as you put it down on the timeline to specific areas. Somebody wants to just take it one. So the nature of the problem determines the scope. The scope determines what? The time frame. You get it? Pastor, the way you are looking at it. The nature of the problem you have identified determines the time frame. So determines the scope. If a problem causes a with which means you get less than that for 10 local governments. So when the problems you have identified, okay, will determine how many places do you think this is That's generally what we spend each year. Go to this place today, the following day I will do this, the third day I will relax. I'll spend 2 days for advocacy in this group. So this timing the friend. Dr. Nato, I live in, I work together. Um, Dr. Mo, you know, I hope your group is in order. Okay, ma'am. So, sincerely, we have a presentation and time 11 o'clock. So we'll be waiting that you come and present. Also, some of you didn't come with laptop. So if you bring this join the columns, we did report for you. Just come tell us what you do. You get it? Just tell us what you do. We need to go to you this time. Since you're not doing any PowerPoint presentation. But when you give it to your various group leaders, you will put this in columns for us.
Hmm? Yes.